Point of care testing is a growing industry, and there's an awful lot of this activity going on in primary care. There's more and more technology going out, blood pressure machines, ECG machines, respiratory machines, echo, and the list just goes on and on and on. And what this facility does, it affords the opportunity to train nurses, doctors, to revalidate nurses and doctors, and to put more and more of this technology out in primary care for the benefit of the patients. And ultimately what it does is it allows the clinicians on behalf of the patients in the community to do one of three things. Number one, to reassure. Number two, to find if there are a cohort of patients that can be managed in primary care. And number three, if there's a real problem that needs onward referral for specialist help. So I think a facility like this is absolutely invaluable.
I think it's a really unique and innovative facility that has been introduced and established here at the University of Sunderland. It represents not only investment by the university through the Higher Education Innovation Fund, but also a partnership approach with Health Education North East, with the local hospitals, the health system in general, so community and primary care, and also with other professionals who might be working in other settings, like on the high street and contract to the NHS. I think what it does is it represents as well an evolution of that partnership between health and education, where the education sector is really responding to the needs of the health needs of communities, but also the health needs of the system, the health system and the professionals within it.
Yeah, we've got a full range of equipment here in the Point of Care Centre that is typical of what's now available. Traditionally, they would have been hospital based, so sophisticated tests that used to be happening in hospitals can now happen pretty much anywhere. And the kit that's available in the centre here is typical of what people would find. Because it's got smaller, because it's got lighter, because it's got easier to use, they're all positive advantages, but the important thing is that it's used correctly and that the quality standards are maintained so that the tests that were traditionally performed in hospitals are as good when they're performed outside of hospitals.
Well, it'll have probably the greatest benefit in terms of research and also in terms of the student experience. So we'll be able to show students real-life visualizations of how the heart's working in disease states as well as in healthy states. So we can look at how exercise affects the heart in a real-life situation and in real time with a very sophisticated piece of equipment. Yeah, the miniaturization, it's becoming smaller and smaller, and the connectivity is increasing, so the ability to download information from these devices to your smartphone is definitely going to be the future of healthcare. It's when you remember looking at Star Trek where they did the medical testing. It's not quite at that level, but who knows, in the decades to come it could reach that.